Hi, I'm Barbara Tauscher. I'm a member of ASGE's Practice Operations Committee. My video tip for today is a top 5 things to look at in your GI practice for 2018. Every year, we need to look at our reimbursement and our revenue streams for the GI practices. The first tip I'd like to give to you is to look at various opportunities to expand your revenue inside of your practice. So look at some ancillary revenues that may be available. Things like adding a histo lab if you don't have one already, capsule endoscopy, anal rectal manometry, pH motility, possibly hemorrhoid banding, and maybe some weight loss services. So 2, take a look at your capacity analysis. Do you have the opportunity to add a nurse practitioner or an MD to your practice? We find that most patients are looking to be added to the practice within 2 weeks. So if you're scheduling for more than 2 weeks out, take a look at adding another provider. Because patients can't necessarily judge the quality of a provider, they're really looking at the availability of a provider. Also look at your current service lines. Do you have capacity to expand those services? For example, are you processing all the specimens through your histo lab? Do you have the capacity to add another histo tech to be able to process all specimens that may be currently being sent out due to just a lack of time to work on them? And is there a service area that you can expand into? Do you have a marketplace that needs a GI provider? And 3, also take a look at the MIPS and the alternate payment models. Continue to attend education sessions so that you can understand more about how the MIPS and the APMs are changing for 2018. 4, look at your infusion centers and review the impact that the biosimilars are going to have to the infusion center. The carriers may have different requirements from the current biologics that we're using to the biosimilars. Understand the reimbursement and the cost analysis, and also take a look to see if there's patient assistance for those programs. Lastly, take a look at your coding and your reimbursement pieces. Of course, coding, understand any new changes that are coming about for 2018. For reimbursement, take a look at your contracts, what RVUs year you're on, and could you increase the conversion factor for your current contracts. And last, take a look at your denial management. Separate all of your denials into the 3 buckets. 1, those that you can control, like your referral and authorization processes. 2, things that are related to coding and billing. And the 3rd one, kind of a catch-all. Just be able to know what things you can control and change and what things you may have to adapt to. This has been my video tip for today. I hope that your staff and your team find this helpful.